Welcome to Medical Lectures channel. In this video, we are going to discuss myocardial infarction. What is basically myocardial infarction? Myocardial infarction is also known as heart attack. It occurs when there is a sudden blockage of blood flow to a portion of the heart muscle. This blockage is usually caused by a blood clot that forms in a coronary artery, the artery which supplies oxygen and nutrients to the heart muscle. Without adequate blood supply, the affected heart muscle tissue becomes damaged or die with passage of time. What are the causes of myocardial infarction? Atherosclerosis, a condition where fatty deposit built up in coronary arteries, narrowing them and eventually leading to a blood clot formation. Arterial spasm, blood clot from other parts of the body that travel to the coronary arteries, also known as embolism, a condition like vasculitis that can lead to inflammation and damage to blood vessels. All of these can cause myocardial infarction. What are the symptoms of myocardial infarction? The symptoms of myocardial infarction can vary, but common symptoms include chest pain or discomfort. This is often described as a feeling of pressure, squeezing, fullness, or pain in the chest. It can also radiate to the arms, neck, jaw, shoulder, or back. Shortness of breath is also one of the symptoms of myocardial infarction. Feeling breathless or having difficulty in breathing, often accompanied by sweating. Nausea and vomiting. Some people may feel nauseated or vomit during a heart attack. Cold sweats. Profuse sweating not caused by external factors, often accompanied by feeling of impending doom. Lightheadedness or dizziness. Feeling faint or dizzy due to decreased blood flow to the brain. What are some factors that can trigger myocardial infarction? These factors include smoking, high blood pressure, high cholesterol levels, diabetes, obesity, lack of physical activity. Family history can also trigger myocardial infarction, stress, unhealthy diet, and age. All of these factors can trigger myocardial infarction. How myocardial infarction is going to be diagnosed? Diagnosis includes combination of medical history, physical examination, and diagnostic tests. These diagnostic tests include ECG, echo, which measures heart electrical activity. Blood test can also be done to detect cardiac enzymes released during a heart attack, and imaging tests like angiography, echocardiography, or cardiac MRI to visualize the heart structure and blood flow. How to treat myocardial infarction? The treatment of myocardial infarction involves medication. These can include clot dissolving medication such as aspirin, beta blockers, AC inhibitors, and statins to reduce blood clotting, lower the blood pressure, improves heart function, and manage cholesterol levels. Angioplasty and stenting. In more severe cases, a procedure called angioplasty may be performed, where a catheter with a balloon is used to open the blocked artery, often accompanied by placing a stent to keep the artery open. Another treatment procedure in order to treat myocardial infarction is coronary artery bypass surgery. For severe blockages, bypass surgery may be required to create an alternate route for blood to flow around the blocked artery. Cardiac rehabilitation is also one of the treatment procedures of myocardial infarction. This involves supervised exercise, dietary counseling, and lifestyle changes to help in recovery and prevent future heart problems.